Hello, welcome to join us at EASD Miss China Daily Highlights. We are here at the EASD 61st Annual Meeting in Vienna. With great pleasure, we have Professor Mikael Rydén with us. He is from Karolinska Institutet in Sweden. Professor Rydén, warm welcome.
Thank you very much. Glad to be here.
Thank you. Professor Rydén, firstly, congratulations for winning the 39th Camillo Golgi Award. Congratulations. We know it's a highly prestigious award, recognize your pioneering contribution in adipose tissues biology. So would you please share with us what is your original intention or motivation to dedicate in this field? And up till now, what is the most important or exciting research findings you would like to share with us? Thank you.
Absolutely. So I think, like with everything in life, it's by serendipity that you end up in a specific research field. I started off as a PhD student in molecular neurobiology, but I decided by chance to, I met up with some professors that recruited me to a lab that was focusing on this field, and that's how I continued. And the most important contributions we've made, I think, are understanding that human adipose tissue is composed of different adipocyte subtypes, that it's very important how lipids are taken up and released in the adipocytes in relation to the development of cardiometabolic disease, and also the central role of adipocytes in mediating and the development of the chronic low-grade inflammation that you see in metabolic disease.
Thank you very much. And also we know you delivered your award lecture titled Everything You Want to Know About Adipose Tissue from Cellular Mechanism to Clinical Complications, right? So we wonder what are the key cellular and molecular mechanisms connecting adipose tissue dysfunction with type 2 diabetes and cardiovascular complications.
Yeah, that would take a whole lecture to go through, but I think the elevator pitch, the few sentences I would make up here is that it all boils down to disturbances in the bioenergetic pathways in the adipocytes. So when that is disturbed in the adipocyte, because the adipocyte grows as you expand the adipose tissue, this results in a dysfunctional adipose tissue, which in turn results to a poor storage capacity and an ectopic deposition of lipids, so they end up somewhere else in the body, and this leads to insulin resistance, cardiovascular disease, etc., etc. So everything starts with the adipocyte, with the white adipocyte, in our opinion.
Okay, so actually, based on what you just shared, you mentioned the low-grade inflammation, right?
Yeah.
So chronic low-grade inflammation in adipose tissue is a hallmark of obesity-related metabolic dysfunction. So can you help us in better understanding what is its pathogenesis and what factors influence it?
Yeah, so part of it is about the size of the adipocyte. So every person has an individual max capacity to increase the size of the adipocytes. And once that is surpassed, which can be at very different BMI levels across the individuals, that leads to, that initiates a large avalanche of changes in the adipocytes that initiate the bad processes that we see, including inflammation and the release of chemoattractant factors that lead to the infiltration of leukocytes into the tissue. So it starts with the adipocytes.
Okay, so what potential therapeutic strategy currently exists to reduce such inflammation and improve metabolic health? What do you think?
So at the moment, there are very few drugs that target adipose tissue, which I think is an unmet need. We have glitazones, but we only have one drug on the market, which is pioglitazone. That drug has some side effects, including fluid retention, osteoporosis in women, and a few other side effects. So that makes it perhaps not always an ideal drug.
Okay.
So I think that there is an unmet need for additional drugs that target adipose tissue specifically and the adipocyte specifically, without conveying side effects on other organs.
Okay. So now I have a question related to adipose tissue expansion. So regarding the two models of it, like healthy adipocyte hyperplasia and pathological adipocyte hypertrophy, right? So what are the essential difference between them, and how to get adipose tissue towards hyperplasia rather than hypertrophy? Can you share with us?
Yeah, so that's unfortunately something that probably is determined by inherited factors. So it's very difficult for a person to change that yourself. You're basically born with a propensity to develop your adipose tissue, to expand it through these different mechanisms, either primarily increasing the number of fat cells or the size of your fat cells. And that's something you can't choose. But what I would say is that if you know what type of adipose tissue you have, that also gives you the knowledge that you should probably be a bit wary about your lifestyle. So I can take myself as an example. My father had type 2 diabetes, so I know that I probably have those genes myself. And that means that I'm very wary and very careful about what I do, what I eat, and how much I move, and so on, because I know I have that risk factor, and probably the propensity to develop a hypertrophic adipose tissue.
Okay. So yeah, you are like an expert. You have a much knowledge, right? So you aware of this, like the gene, which is very important. So I wonder. So in practical practice. So besides simply measuring fat quantity, what are the effective methods to assess quality of patients' adipose tissue?
Yeah, so at the moment, biopsies of adipose tissue are, of course, something you only do within a research unit, and you have to have quite some experience in analyzing adipose tissue in order to assess the phenotype. So I would say that some simple measure of the quality of your adipose tissue is measuring just waist-hip ratio. So the waist is an indirect measure of how much ectopic fat you deposit. So if you have a larger waist compared to your hip ratio, then that probably tells you that you put too much fat into the abdomen, which is a bad thing.
Yeah. Well, excellent. And lastly, we know you have done so much work and accumulated a lot of experience. So for you, what do you consider as the most promising therapeutic intervention targets for improving adipose tissue dysfunction? And you talk about like patients, right? So what are the main challenges in translating such maybe cellular level findings into patient-centered treatment plan?
Yeah, there are many challenges, and I think that even though I'm extremely happy that we have a development of drugs now that are super efficient, on body weight, on important outcomes, one has to remember that as soon as you stop taking them, you regain your weight. So we definitely need to have additional drugs that allow us to lose weight, but then to keep that. So maintenance drugs, and also drugs that attack different aspects of tissue dysfunction, including adipose tissue. We know, for instance, that cardiovascular disease, even though the mortality rates are going down globally, it's still not zero, so there is a residual risk that needs to be addressed. And I think that in the future, in the next 10 to 20 years, we will see an additional development of even more efficient drugs with better effects on multiple aspects of clinically relevant outcomes. And I look forward to coming to these types of meetings and see that new data being presented.
Thank you very much, Professor Rydén, for your informative sharing with us. I think what you have been doing is very important. That's why I think that one of the reasons you got this award. Congratulations again. Thank you very much, and I look forward to have future collaborations with you. Thank you very much.
Thank you very much, and bye China.
Bye bye.